there is good evidence that the Delta variant, first identified in India, is more transmissible than previously circulating viruses and other variants of concern or interest. It's rapidly becoming the dominant SARS-CoV-2 variant in many countries around the world, including here at home. Now, to give us an update on this, I'm joined by Dr. Richard Lessels from the KwaZulu-Natal Research, Innovation and Sequencing Platform, also known in short as KRISP. Good afternoon, sir. Thank you very much for your time, Doctor.
Good afternoon, Dan.
Yeah, what is the Delta variant picture like? If you would describe it very briefly in South Africa, I mean, is it everywhere now?
I think it is. I mean, as you know, our genomic surveillance kind of works across the country, and we have a lot of labs in the different main urban centres processing these samples and doing the surveillance work. And basically everywhere that we're sampling with recent samples, so taken from kind of June, we're finding very high levels of the Delta variant. So when we look at the trend in the genomic surveillance, it's kind of rapidly becoming the dominant variant and kind of displacing the beta variant that was previously in the country and was responsible for the vast majority of infections. So we're seeing that picture quite consistently across the different provinces now.
Yeah, when you say replacing the beta variant, just for me, just for my understanding, I'm not a scientist, are you saying that the beta variant is disappearing?
Well, what we're saying is the beta variant is not spreading nearly as much now, and that the main virus that's spreading and causing infections is the Delta variant. What we're not sure completely about yet is whether the beta variant will completely disappear. And in technical terms, we say kind of goes extinct. So It's no longer spreading at all. We don't yet know that yet. And so we'll be keeping a close watch on whether it completely disappears.
Yeah, but currently your efforts and energies are consumed by this Delta variant, as you say, which is spreading and is spreading fast. Is it responsible for most of the daily infections we're seeing in the country? And we are in the middle of a third wave, and provinces like here in Gauteng, where we are broadcasting from as ENCA, have been in this third wave epicenter for quite some time now, but we understand KwaZulu-Natal, it's spreading there as well.
Yeah, you're right. I mean, I think based on our genomic data, it is responsible for the majority of infections now. As you know, the genetic sequencing is a complex procedure, so it takes a couple of weeks to get data. So we're always looking at kind of cases 2 or 3 weeks prior to now. So when we look at the last week of data, and that's kind of the 3rd week of June, about 3/4 of the cases there are the Delta variant. Yeah, so very likely by now that's closer to kind of 90% or more, very likely.
Yeah, and that's and with the numbers growing and with it spreading, and we're not yet, according to when I spoke to the NICD the other day, we don't know when this current of third wave will spike. So we're in big trouble, so to speak. Now, while I have you, Dr. Lessels, there are some reports about a new variant that's showing itself up. And then when I started the program at 1 o'clock, I said, what, the V? Another one? I mean, these variants are popping up everywhere in the world. What's Lambda? Where is it? Can we stop it from coming to South Africa?
That's right, and there seems to have been a lot of alarm raised about this Lambda variant in the past couple of days or so. But just to be clear, we haven't detected that yet in South Africa. So that is what we term a variant of interest, according to the World Health Organization. So it's essentially on the watch list. There are concerns about it because of the pattern of mutations that are in the genetic code of that variant. But we don't yet fully understand its kind of behavior and its properties and whether it is more efficient at spreading from person to person, whether it might partially evade some of the vaccines. We don't have good data on that yet. And at the moment, we shouldn't be concerned about that. It's largely spreading in South America. It has been introduced to some other countries, but it's not spreading nearly as widely as the Delta variant. So I think what we're asking is that the public don't get too alarmed about this. Some of the stories saying that it's the most transmissible and most deadly variant. I don't think the data we have support that statement at the moment. And so you need to just kind of trust the scientific community to keep watch on this variant and to get a better understanding of it. And of course, we'll alert people if we do see that being introduced to South Africa.
Okay, on that point, I know we are out of time. My producer, Aisha Jacobs, is not going to be pleased with me, but I need to ask you this. On that very point, just a few months ago, we had a similar kind of advice around the Delta variant before it came to South Africa. No, we're watching it. It's not here yet. There are 1 or 2 cases. I'm getting a similar message from you now, and I want to be optimistic and hopeful. There's very little known about this Lambda thing. And then I'm wondering, aren't these viruses named alphabetically as well? You know, my technical director, Rob, earlier was saying, what happened to E, F, G, H, I, J, K, while we get into Lambda? So what else how can you assure us that you are really on the watch as scientists in South Africa for any other variant, including all this one called Lambda now that's doing the rounds in South America, and that as soon as you sneeze it or anything, you smell it, you'll be telling the country, let's take care?
Yeah, I mean, you're right. I mean, these letters are there. So there are the 4 variants of concern: alpha, beta, gamma, delta, and then there are currently 7 variants of interest. And so that's Lambda is the last of those 7 variants of interest. So they are being monitored closely on a global level. And we are also doing that here in South Africa, and we do the kind of regular surveillance. So we're monitoring around the country in the different provinces and doing that based on the routine diagnostic tests. Unfortunately, as we've seen through this pandemic, the virus moves very quickly, and it moves both within and outside borders very quickly. And so all the work we do to monitor it, it's hard to keep up with the virus. And so, unfortunately, sometimes it's spreading quite widely before we can actually detect that in our surveillance mechanisms. And so that's not an excuse. It's just a kind of explanation for why sometimes it's not initially apparent how much a new variant is spreading until it's quite prominent.
No, Dr. Lessels, thank you very much for your informative interview
Thank you.
Just allaying our fears about Lambda, and that you're watching it, and like all other scientists globally. Currently, it's just a variant of interest. It's being watched.